Every year, millions of lives are lost to heart attacks, the silent, sudden, and often devastating events that can strike without warning. Yet, there is hope, and there are concrete steps you can take that may save your life, even if you find yourself alone when it happens. Today, we come together not just to talk about survival, but to empower you with the knowledge and practical strategies you need to act decisively during one of the most critical moments you may ever face. To truly understand how to survive a heart attack when you are alone, you need to begin with knowledge. What a heart attack is, why it happens, and how your body signals for help when things go wrong. Knowledge, as the saying goes, is power, and nowhere is this truer than in a health crisis. Take this time to invest in yourself and your future, because when it comes to heart health, every second counts. What exactly is a heart attack? Medically termed a myocardial infarction, a heart attack occurs when the flow of oxygen-rich blood to a section of the heart muscle becomes suddenly blocked. Most often, this blockage happens because of a buildup of fat, cholesterol, and other substances that together create a plaque in the coronary arteries, those critical highways that nourish your heart with the blood and oxygen it needs. When that plaque ruptures, a blood clot can quickly form, choking off the flow and causing permanent damage or even death to sections of the heart muscle. This is not just a matter of numbers on a page. Every year, heart attacks claim as many as 18 million lives worldwide, making cardiovascular disease the leading cause of death. Factors that contribute to heart disease, like an unhealthy diet full of trans fats and sugars, limited physical activity, smoking, high cholesterol, high blood pressure, diabetes, and even family history, can quietly build over time. The result is not just a tragic statistic, but families torn apart, loved ones lost, and dreams ended too soon. But survival is not out of your reach. The keys lie in understanding risks, spotting symptoms, and knowing exactly what to do, especially when you're alone. Heart attacks don't always play out like the dramatic scenes in movies. Symptoms can vary and can even sneak up on you, so awareness is your first and most powerful line of defense. How do you recognize the signs of a heart attack in real life? Unlike the classic Hollywood depiction, a heart attack often begins subtly. The single most common symptom is chest discomfort. You might feel pressure, squeezing, tightness, or pain, which could last for more than a few minutes or go away and return. This discomfort isn't always excruciating. It may feel more like fullness or indigestion. But chest pain is far from the only warning sign. Many people, women in particular, report other symptoms that don't always involve the chest at all. Listen to your body for a pain or discomfort in one or both arms, pain radiating to the back, neck, jaw, or even your stomach, shortness of breath with or without chest discomfort, cold sweats breaking out for no obvious reason, sudden feelings of nausea or vomiting, rapid, irregular heartbeats known as arrhythmia, lightheadedness, dizziness, or feeling faint, sometimes accompanied by anxiety or a sense of impending doom, unusual or unexplained fatigue, weakness, or lethargy, and a sense of fullness, indigestion, or heartburn, even if you haven't eaten anything unusual. Any of these symptoms, especially in someone with risk factors like high blood pressure, diabetes, obesity, a family history of heart disease, or a history of smoking, should be taken seriously. Heart attacks can develop over hours, days, or even weeks, so pay attention to persistent or worsening signs and do not brush them off as something trivial. But what if you feel these symptoms and you're alone? Would you know what to do? Taking immediate and correct action could mean the difference between life and death, permanent damage, or a full recovery. Step 1. Call emergency services right away. This cannot be stressed enough. In moments of panic or confusion, some people hesitate, thinking the symptoms will go away or that they don't want to make a fuss. But every second is precious. Calling 911 or the emergency number in your country brings immediate help. The operator can provide vital instructions tailored to your situation, keep you calm, and dispatch trained professionals to your location. Never attempt to tough it out or wait for the symptoms to pass. If you have access to aspirin and aren't allergic, take it right after calling emergency services. Aspirin works by thinning the blood and inhibiting clotting, helping slow the blockage forming in the artery. Chew a full adult aspirin, 325 milligrams, or 2 baby aspirin, 81 milligrams each, so it absorbs quickly into your bloodstream. Don't swallow it whole. Chewing gets it working faster. If you don't have aspirin or are unsure whether you're allergic, don't waste time looking. Focus on getting help. Next, avoid trying to drive yourself to the hospital at all costs. It's a common and dangerous mistake. Heart attacks can cause fainting or cardiac arrest with no warning. Loss of consciousness behind the wheel could lead to a fatal accident, endangering not only your life but others on the road. Stay where you are, unlock your door if possible, and let paramedics come to you. Your body's position can also make a difference. If you can, lie flat on your back with a pillow under your knees. Placing a pillow under your knees can reduce strain on your core muscles, lower blood pressure slightly, and allow your diaphragm to operate more efficiently, helping you breathe with less effort. If you feel lightheaded or the position makes you uncomfortable, consider sitting upright with your knees at a 90-degree angle and your feet resting on a stable surface. The next key point is often overlooked. Remain as calm as possible. Your emotional response to a heart attack can worsen matters, since panic and anxiety flood your body with adrenaline, potentially increasing your heart's workload and narrowing your arteries even further. Take slow, deep breaths, counting each inhale and exhale. Focus on staying calm until help arrives. You might wonder, what if things get worse while you're waiting? If you feel your moments from losing consciousness and no help has arrived, try coughing sharply every couple of seconds while taking deep breaths in between. This cough CPR is not a medical treatment. It's not shown to save lives and shouldn't delay your call to 911 or chewable aspirin. But some physicians suggest that, in rare circumstances, intentional coughing may help maintain circulation for a very short period before losing consciousness. However, use this only as a last resort, and remember that professional help is always your best option. Why is acting quickly so critical? The impact of a heart attack is measured in minutes. Heart muscle begins to die after as little as 20 minutes without oxygen. The longer the delay in restoring proper blood flow, the more severe and permanent the damage becomes. Survival rates and the chances for a full recovery increase exponentially the sooner treatment begins. Fast action doesn't just improve your chances. It could be the difference between a short hospital stay and lifelong complications like heart failure or arrhythmias. This is why paramedics and emergency rooms are trained to immediately administer oxygen, pain relief, and medications that break up clots and stabilize the heart. The goal is always to restore blood flow through medications or, if necessary, an emergency medical procedure. Consider the story of John, a real-life example that highlights the importance of being prepared and acting decisively. John was home alone when he felt a sudden tightness in his chest. His first instinct was to try and rest, thinking it was indigestion or perhaps anxiety. But as the discomfort grew into pain and began radiating to his left arm, John remembered the warning signs he had read about. He didn't waste time debating. He called 911 straight away. The paramedic on the other end of the line remained calm, reassured him, and told him to find an aspirin and chew it immediately. By the time the ambulance arrived, John was still alert and able to provide valuable information on his medical history, allergies, and medications. The rapid response allowed doctors to intervene quickly, and today, John is healthy and living proof that quick, informed action saves lives. Preparation is everything. By knowing the warning signs of a heart attack, knowing your risk factors, and planning your response, you equip yourself with the tools to survive. Make sure you always have access to a phone, and that emergency numbers are easily accessible. If you take prescription medications, keep a copy of your medication list and medical history in a place where first responders can find it easily. And remember, keeping aspirin nearby in your home or bag is a smart precaution if you are at higher risk. But prevention is always better than a cure. While our focus today is on surviving a heart attack, every choice you make in daily life shapes your risk profile. Heart disease is not inevitable. A heart-healthy lifestyle can dramatically reduce your risk, giving you a stronger foundation for health and longevity. Here are steps you can take today to protect your heart and lower your chances of a heart attack, even if genetics put you at greater risk. 1. Adopt a balanced, nutritious diet filled with fruits, vegetables, whole grains, healthy fats like olive oil and avocado, and lean proteins such as fish and chicken. Limit processed foods, saturated fats, salt, and added sugars. 2. Get moving. Engage in regular physical activity. Even brisk walking for 30 minutes a day, 5 times a week, can make a measurable difference in your overall heart health. Find activities you enjoy, dancing, swimming, cycling, gardening, and make movement an enjoyable, non-negotiable part of your routine. 3. If you smoke, quit now. Smoking is one of the fastest ways to damage your arteries and double your risk of heart attack. Seek support, and remember that your body begins healing as soon as you stop. 4. Manage your blood pressure, cholesterol, and blood sugar. Regular checkups enable your healthcare provider to catch problems early and provide medications or lifestyle interventions as needed. 5. Reach and maintain a healthy weight. Obesity puts significant strain on your heart, raises your risk for diabetes, and can lead to high blood pressure and high cholesterol levels. 6. Don't ignore your mental health. Chronic stress, anxiety, and depression increase inflammation and can worsen other risk factors. Practice relaxation techniques like meditation, deep breathing, or yoga. Nurture strong relationships and seek help when you need it. 7. Limit alcohol and avoid illicit drugs. Excessive drinking and drug use can weaken the heart muscle and disrupt heart rhythms, increasing the possibility of a heart attack or other cardiovascular problems. 8. Sleep matters too. Aim for 7 to 8 hours of good quality sleep per night, as poor sleep increases your risk for high blood pressure, obesity, and heart disease. 9. Stay informed. Understanding your family history and getting regular screenings can alert you to hidden risks. If someone in your family has had a heart attack or stroke, make sure your doctor knows. Remember, heart attacks often happen without warning, but you have more control than you might think. Years of lifestyle habits create resilience, or lead to higher risk. The actions you take today, both for prevention and in emergency response, can ultimately save your life. It's also important to know what not to do during a suspected heart attack. Do not try to walk it off or convince yourself all you need is a nap. Avoid taking unnecessary medications like nitroglycerin if you are not already prescribed it and instructed to use it. Do not eat or drink anything unless advised by emergency services, as this could interfere with treatment or surgery. For many people, the idea of experiencing a heart attack alone is terrifying, but it doesn't have to be paralyzing. Technology can be your ally. If you have a smartphone with voice assistance, you can activate emergency services hands-free. Keep your phone charged and within reach, and teach family members how to use emergency alert features. Individuals who are at higher risk, like those previously diagnosed with coronary artery disease, previous heart attacks, or known arrhythmia, should consider upgrading to medical alert systems that can notify emergency contacts and responders immediately at the push of a button. Education is a crucial piece of the puzzle as well. The more you know about the risks, warning signs, and immediate first aid for heart attack, the better equipped you are to help yourself, and, equally important, to assist friends, colleagues, or loved ones if they collapse nearby. Consider taking a basic life support course to learn hands-on CPR and first aid, as these skills can tip the balance towards survival in countless emergencies. Reflect for a moment. When was the last time you talked to your family or coworkers about heart attack risks and response? Imagine how the world might change if every person was as prepared to save their own life as they are to go about their daily routines. Empowerment comes with education. Share what you know, encourage those you care about to learn the signs of heart attack, and discuss what everyone should do in an emergency. Sometimes, myths and misinformation can put lives at risk. For example, you may have heard about coughing forcefully to restart a heart during a heart attack. While this cough CPR technique is commonly spread online, it is not recommended for use outside of specific situations, namely monitored settings like hospitals or when specifically directed by medical professionals. Rely on expert advice, not rumors. And always prioritize calling emergency services first. A well-prepared action plan helps make a terrifying moment manageable. Create a plan today. Write down the most common signs and symptoms of a heart attack. Place emergency numbers where you can see them, on your fridge, by your bedside, and saved as favorites in your phone. And keep aspirin accessible but out of reach of children and those it may harm. Tell family and close friends about your medical history, allergies, and what to do if you ever call for help. Ask your doctor for specific advice, especially if you have known cardiovascular risk factors. And teach your children, aging parents, or housemates about heart attack response. Knowledge could save their life or yours. In addition to learning how to survive a heart attack when alone, you can further protect yourself by reducing social isolation. People living alone may want to check in daily with a friend or neighbor and consider using wearable health technology, such as smartwatches, that can alert others if you're in distress. Let's talk for a moment about recovering after a heart attack, because surviving the acute event is only the beginning. Your journey doesn't end with emergency treatment. Cardiac rehabilitation and lifestyle modification are essential parts of regaining your strength and preventing future attacks. This includes supervised exercise, dietary counseling, emotional support, and medication management. If you or someone you know has survived a heart attack, seek guidance from your healthcare provider on rehabilitation programs and adhere closely to your prescribed treatment plan. It's important to address how heart attacks can be different in women. Women may experience heart attacks differently than men, with less obvious symptoms like shortness of breath, nausea and vomiting, and pain in the back or jaw. Women often wait longer before seeking help and are at greater risk of misdiagnosis. Awareness of these differences is key, and if you are a woman or care for women in your family, take these signs just as seriously as the traditional symptoms. One last point on risk. Some conditions may cause silent heart attacks, with few or no symptoms. This is more common in people with diabetes, who may not feel the typical pain because of nerve damage. Regular medical checkups, awareness of even subtle signs like unexplained fatigue or mild shortness of breath, and maintaining open communication with your healthcare provider are vitally important. Heart health is closely linked to overall well-being. Investing in your heart means investing in your whole life, your family, your goals, and your future. Let's review once more the core steps for surviving a heart attack when you're all alone. 1. Recognize the warning signs: chest discomfort, pain radiating to other areas, difficulty breathing, cold sweat, lightheadedness, or nausea. 2. Act immediately. Call emergency services. Do not wait to see if symptoms worsen. 3. If available and safe, chew a plain aspirin, 325 mg, or 2 baby aspirin, 81 mg each. 4. Stay where you are. Do not attempt to drive. Position yourself comfortably to reduce strain and help with breathing. 5. Remain calm. Slow, deep breaths are your friend. Fear and panic worsen the situation. 6. Prepare ahead. Have your medical information, medication list, and emergency contacts available for responders. 7. Focus on prevention every day. Eat well, stay active, manage stress, get regular medical care, and keep your risks as low as possible. Heart disease may be the world's leading killer, but you are not powerless. Every positive change you make lowers your risk. Every ounce of preparation raises your chance of survival should the unthinkable occur. As we bring this important message to a close, please remember, the life you save may be your own, or that of someone you love. Share this information with friends, family, and coworkers. Invite conversations about heart health at your next family gathering or workplace meeting. The gift of knowledge is truly priceless, and the right actions taken at the right time can make the difference between tragedy and hope. If you found this information helpful, don't just keep it to yourself. Spread the word to those who need it. Encourage your community to learn the warning signs and best responses. If you haven't already, seek out more resources on cardiac health, talk to your doctor about your risk, and consider taking a CPR class. Your heart is at the center of all you do. It powers every dream, every laugh, every embrace. Protect it, cherish it, and be ready to act if ever that dreadful moment comes. May you enjoy many healthy years ahead, armed with the confidence that you are prepared. The knowledge you hold now is your shield against uncertainty and your best weapon against the silent threat of heart attack. Thank you for taking your health seriously, for learning with us, and for promising to protect yourself and those you love by knowing exactly what to do when every moment matters. Stay safe, stay alert, and keep making smart choices for your heart.